And thank you for joining us. With us today is Dr. Michael Ghassibi, spine surgeon with Orthopedic Associates of Meadville. Thanks so much for joining us.
Thanks for having me.
Well, before we get into your specialty, let's go way back. What point in time did you know that this was the path you wanted to take as a career?
Oh yeah, so really it first started out as a guy that liked to play sports and was active. Really orthopedics definitely calls us. It's we are able to give people the active lifestyle back. So it just started out there, but during my training, seeing how powerful these spine surgeries can be from patients from before to after really influenced me, and having great mentors to guide me along really got me into considering spine surgery in itself.
What sports did you play?
So I played, believe it or not, rugby, and I did also cross country and tennis and basketball.
Excellent.
So any season we'd try to find something fun to do.
Where'd you grow up?
So originally I grew up actually in New Jersey. So I actually lived about 30 minutes from New York City, and believe it or not, I actually did not want to work in a very hectic and busy place. So when we were looking for training and jobs, we actually wanted to be in a nicer, quieter settings with, I would say, in my opinion, hardworking people and be part of a nice community.
Well, so that leads you to Meadville. What was that path to get here?
Yeah, so really we've always been around here for the past 10 years. I did my training over at Youngstown Mercy Health System, which is a level 1 trauma center and tertiary care center. So really we were just 50 minutes where we'd actually know we'd spend our life here. And I did my medical school training over in Erie. So we were familiar with the area, but we just were lucky enough that we found an opening here, and it was in a place we liked. And in addition, as we all know, my wife's family is kind of close around, so it always helps too with the kids.
When you did your research and looked into Orthopedic Associates of Meadville, such a rich history, did you start looking at that and go, wow, this is a great place to go?
Yeah, so really it's well known even when I was in Erie, and even when I was across the border in Ohio, really how well patients were doing and what a great reputation. So it was really an honor to be able to be part of this great orthopedic association.
When it comes to spine surgeries, and now we'll get into your specialty, kind of bring us that range of patients. You're seeing folks from what sort of injury to, maybe in an athlete to somebody later in life?
So that's, again, the beauty of spine surgery. It is, even though it's such a specialized field, there is so much out there from, like you said, the early ages to the older ages. So we'll see patients young that have what we call the disc herniations, all the way up to patients that are older, and as time has gone by, their arthritis has crept up. Like we say, just as we all get gray hairs as we get older, we also get arthritis in many places. Some people have more gray hairs than others, hence why they see us more. So we'll go to even that, and even patients that have had surgery at other places that things didn't go well, we're doing complex, revision surgery. So it really is a big variety, and we're happy to tackle it here.
Walk us through, from training to now, how much has technology played a role in what you do, and how procedures have changed over time, and what does the future look like?
Yeah, so absolutely. I always say this, what we're doing now is nothing like how it used to be just even 10 years ago. I do find it is, in a good way, we're able to change the common misperceptions of spine, as we'll always have a friend or someone that's had a surgery that didn't do well, that need another surgery. But I really would say that at this point, we're in a golden age of technology for spine surgery. What would take us 6 hours to do with a big open incision, we're now doing sometimes less than 2 hours, 1 hour, with smaller incisions. The newest technology, thankfully, is being done here. So anything that we're seeing advanced, we're able to get here. We have the same technology as any big academic center. We're using things like CT guided navigation. So there is no guesswork anymore in spine, and we wouldn't want that. So every time we do a process, it is consistent and straightforward. I'm able to visualize your whole anatomy without even opening you up as we get special scans. We see the anatomy on the screen. I'm able to kind of formulate our plans and get the implants in perfect position. Just as important is the approaches. So the standard go from the back and open everything up. Obviously, that's may have some worse outcomes, but sometimes it's needed. Now we're able to go from smaller incisions from the side into the front to achieve the same effect, but with less pain, faster recovery, and very much higher satisfaction.
What's that reaction like from patients knowing that they can be taken care of here locally and that they don't have to leave the area for treatment like that?
Oh, absolutely. So, we do find that in the end, if you can get great care, if not the same, if not better, at a local place, it's always just better for everyone. Instead of the long drives, trying to find parking at a place, 2 or 3 hours away, we're able to do just as much, if not more, at our place here at Meadville Medical Center. So they've been ecstatic about it. And, even at this point, we're actually having people come from the cities to see what kind of procedures that are new and innovative here in our own community.
We talk about the technology and how much that changes. That means keeping up with the latest technology changes and procedures. How much work are you doing outside of being in the office, doing research and learning about those new technologies?
Yeah, so as my wife will tell you guys, I've taken this specialty and spine is my life. I'm so happy to do it. So every day and every week, I'm looking up every single new article and journal because it is super exciting. It's always great to be able to find newer, innovative ways to help our patients. So I would say really at this point, we are at the most up-to-date we can possibly be in terms of the newest techniques and technology. And really with the help of a whole team, not just me, we continue to have the most state-of-the-art equipment. In addition, as my partners will say as well, they're able to do innovative techniques.
Obviously, if somebody is in a major accident with sports or a vehicle accident or a work accident and something happens to one's spine, they're going to come and see you. But what are some other maybe some traits that somebody might be experiencing that they just think, okay, maybe I should see a specialist?
So yeah, I always say we always get, as we get older, aches and pains, of the back. But the things where, hey, this is not going away. I thought this was just another sprain that'd go away in a week or two, but this is staying now for a couple months. Maybe the patients may say, and now I feel weakness going down my legs. I'm starting to feel some shooting pains that doesn't feel normal. It can also be subtle things like, hey, I used to like to walk for miles on end, and at this point, I find myself having to sit down after about 100 feet. Unfortunately, we're all, thought this, that maybe it's just because of old age that we're getting all these, kind of roadblocks to being active. But when they see us and we find things, we say, no, that's actually not from old age. You have a lot of bone spurs that are preventing your body from moving. So it's always a pleasant surprise when we're able to find this and treat these patients and they're back to doing what they used to love doing 10 years ago.
So people visit the website, which is mmchs.org. They're going to see things like cervical disc replacement, lumbar fusion, things like that. But these other things that you just mentioned are other good reasons to see a specialist and to get on that path to health.
Yeah, and I also say this, in the end, surgery is our last option. So I really do mean it. We see a lot of patients, and I always find that people are worried when they go to see an orthopedic doctor or a spine doctor that they're going to be just going there to sign a paper to have surgery, and that's absolutely not the case. I would say maybe, on average, only about 10% of our patients in our practice actually get spine surgery, as there are many other things that we can help facilitate and coach our patients of different therapies and treatments that aren't surgery that will get them just as good a result if reasonable.
When it comes to spine health, what can folks do now? They might find themselves in a work environment where maybe they're standing all day, or students who sit all day, or what are some things that you can do to, again, continue with thinking about that healthy spine?
So, in the end, and I tell this a lot, multiple times during the clinic, that a lot of spine problems like having a bad back or degenerative discs are mostly genetic. So I have farmers that work every day in and out that we get the x-rays and the MRIs, and they have the best backs I've ever seen. And like you said, I have people that do more like an office job that they really have the worst back. So unfortunately, a lot of this can be genetics. But that being said, there are plenty of options, and that's the beauty of having a big team here, not just me, but things like our physical therapists training exercise to strengthen other muscles to offset the back loads as well, in addition to our pain management injection team. So there are plenty of ways. In my opinion, we always say this as orthopods, if you're keeping active, that's the healthiest way to be active.
When you're at a hospital like Meadville Medical Center, you mentioned getting to know your patients, but you just mentioned working with other departments and other staff members. That has to be nice to have that relationship with other people within the hospital system.
Oh, for sure. So really, even though we do, surgeries that help our patients, as my partner will tell you as well, my joints partner, we can do a great surgery. We can all be happy about it, but a lot goes on before the surgery for successful outcomes. I am not a one-man army. This takes a whole team, and thankfully at this community hospital, Meadville Medical Center, we have a great team with lines of communications throughout. I have the physical therapist, I have the primary care family docs reaching out to me because we're all, one community of, clinicians helping our patients every step of the way.
And for the patient, I'm sure the response is outstanding that they get that level of care here at home.
Absolutely, and because we're all all a very great environment here, and we all live in this community. Like you said, I'll have our patients, primary care docs, reach out to me. So even before seeing me, we'll have things in set for them to make sure they have a good chance of having good relief of their back problems.
Well, at the end of the day, what do you do to relax and unwind?
So at this point, just like many of us, we're starting the family. So we have a daughter and we have a second one on the way.
Congrats. So
really at this point, I am doing the whole dad family of being a girl dad. So that takes away a good amount of my time, including just, being in touch with friends and family.
Do you enjoy the variety that you have here in the small town, the recreational opportunities? It's amazing when you look at like the arts and what is available around here. There's really a lot that we take for granted, I think, sometimes.
Yeah, in the end, we still have a great college. Here we have a lot of, restaurants that I do love going to. Really, as we all know here, the summers here are beautiful. Having Conant Lake, which is a frequent place I go on the weekends, is so fun. And really the winters, as long as you keep active and enjoy skiing and snowboarding, that's always fun too. So there's plenty to do here, and we're super happy.
For those who might be looking at Meadville Medical Center as a career opportunity, what would you say to those folks?
So a big reason as well I came here is because really in the end, we have great communications with not only our fellow clinicians, but also the administration team here. And I will tell you guys for a fact, I've never had bosses here that have been so kind and so reasonable and always wanting to make sure we're having a great experience. Only here do I feel that you can go straight to our CMO and ask him how he's doing. Having any questions, he's right there. He'll say hi. I do find that how things are going, there's more bigger conglomerations of healthcare. So really, you may be reporting to someone out of state, where I think our best interests are with people here that want the community to do well in itself.
And then you mentioned too the unique experience of in specializing in spine. Every day is different. You're seeing a farmer one day, maybe somebody who's in the office another day, or somebody who works at tool and die, the next day. It just seems like there's variety there every day.
There's variety, but I think I really do mean this. The common theme is people here are good people that are hard workers. They want to get back to work. They want to enjoy their life. This is an area that most people here like to be active and enjoy the outdoors. So it is, such an honor and pleasure to be able to work with everyone here.
Well, we greatly appreciate your time. We've learned quite a bit. And again, if folks are having any sort of issues, they see their primary care physician and then get referred to your office?
Correct. So we're always happy to see everyone and anyone. So a lot of times we'll actually have people call our office. But any way we're able to help you, if in the end, if you call our office, I have a great schedule that makes sure that we take care of everyone at a reasonable time.
That's wonderful. Thanks for your time.
Oh, thank you for
Greatly
having me.
Appreciate it. And thank you for joining us as well.